I also hear repeatedly about the number of new patients getting coverage through the Affordable Care Act across my state. For example, a network of 4 rural health clinics in Whatcom County reported a 43% increase in patients last year. That's great news, but it also means we need to think carefully about how to make sure there are enough doctors and other healthcare providers to treat all of the patients.
The health care program known widely as Obamacare has, to those in charge of certain states, been given a new and more fitting nickname, utter disaster. And while it may not be rhythmic or something that would make for a good T-shirt, it fits because Republican governors are rightly pointing their finger at the Affordable Health Care Act, President Barack Obama and those who touted its wonders, asking if they missed the ridiculous amount of money it's costing certain people thanks to Medicaid. Making sense of it all, our guest is president of the Pacific Research Institute, who warned years ago about such issues in her book, The Truth About Obamacare. Sally Pipes. Sally, good to see you again.
Good to see you, Ed.
Sally, this is just incredible when you think about it. Medicaid enrollment is skyrocketing past any of the expectations, and those governors are saying, I told you so, and makes them wonder, could they not, the Obama administration, seen this coming?
Well, as you know, 29 states and D.C. agreed to take the federal funds to expand their Medicaid programs. 21 states did not. We've seen Medicaid increase to 70 million people in America, about 12 million new signups from the Medicaid expansion program. But the interesting thing is, are these 12 million people and the others on Medicaid now able to access doctors and care? That is the big issue. And also the issue of stress on state budgets, which are in many states, including California, are really hard pressed at the moment.
Well, here's another thing, too, and you've pointed this out rightly, emergency rooms. And we had talked about this before Obamacare actually became law, that people would be going in droves to the emergency room, the only place they could get care. Now it's happening. They're overwhelmed, which means the people who have real emergencies are the ones who are getting pushed to the back.
Well, exactly. I mean, you know, we know now that 26% of doctors in America are not even taking Medicaid patients. And a new survey just came out from the American College of Emergency Physicians showing that in the past year, ER use is up 75%. And why is it up 75%? It's because these people on Medicaid, when they call a doctor's office, either will not be taken because the docs aren't taking Medicaid patients, or they're going to be on a waiting list. So what do? Do exactly what the president said was one of his goals under Obamacare, was to stop people using expensive care in emergency rooms.
Here's something else that I found really despicable in so many ways that it's happening. According to a study by the Commonwealth Fund, roughly 1/4 of the people with health insurance are paying deductibles and out-of-pocket expenses that are so high they are considered underinsured. Sally, how could that happen?
Well, and remember what the president said. In addition to getting people not to use the emergency room, he was going to get universal coverage and bend the cost curve down. Under the exchanges in the states or healthcare.gov, we are seeing that the premium increases and the deductibles make it impossible for people in middle income categories to be able to pay these high deductibles. And we're going to see more of it next year. A number of the insurers have just come out and said they're going to have to increase their premiums significantly because the use of healthcare has not been covered by the young people, the young invincibles, the 18 to 34-year-olds. They thought 40% of the people would be on the exchange would be in that category. It hasn't happened. So further stress for higher deductibles, higher premiums, and fewer networks of doctors and hospitals. So that, combined with the fact that, you know, under Medicaid, doctors are reimbursed 35 to 42% below what they get for treating a private patient. So all of these stresses are making Obamacare look worse. And as the former, as the Canadian, Chief Justice of Canada, Beverly McLaughlin said, just because you have a card showing you have health care, whether it's Medicaid or in an exchange, doesn't mean you actually have access to care. And so we are seeing this under the Affordable Care Act, that people are not having access to care and they are using emergency rooms, which, as we know, is very expensive, and what the president did not want to happen. And Zeke Emanuel was behind that as well.
Sally, I only got about 45 seconds left here, though. What needs to happen to keep this system from going into a complete free fall?
Well, of course, we're waiting sitting on the edge of our chairs, waiting for that Supreme Court King v. Burwell decision at the end of June. I'm still feeling slightly optimistic that the court will rule the subsidies to those people on the federal exchanges, healthcare.gov, are illegal. There's going to be a bit of confusion, but I think it's very positive. I think with Dr. Tom Price's new proposal to repeal and replace Obamacare without the bridge transition, but with refundable tax credits, age-based. I think it's terrific. I think we're really, the American people finally realize that the Affordable Care Act is not bringing about affordable, accessible, quality care.
And let's hope that the Supreme Court makes the right decision, because this is difficult to look at. Sally Pipes, always a pleasure to have you on the show. Thanks so much for joining us.
Thank you.
All right, it's our pleasure. Oh yeah, by the way, people are not even protected against high health care costs. Wasn't that supposed to be the reason for Obamacare? Stay here. The Hardline continues.